My name is Dr. Evelyn Reese, and I'm a faculty member in the Division of General Academic Pediatrics here at the Children's Hospital of Pittsburgh of UPMC. General Academic Pediatrics, we call it GAP for short, has 20 faculty and fellows, and we are dedicated to patient care, medical education, and clinical research. It's very important to us here at Children's that all of our residents get a firm foundation in primary care education regardless of what their long-term career goals are. And the components of primary care education are the continuity clinic, the primary care center rotation, and the newborn nursery rotation. And of those three, continuity clinic is the biggest component. That's because it's a longitudinal experience, and residents participate one afternoon a week for 3 years of the residency. And for me, continuity clinic was always my most favorite part of my residency, which is why I chose to do this for a career. I really enjoy the continuity with families as well as with the practices. I think residents do also. Many of the residents in the community settings have joined their practices after graduation. The primary care center rotation is a block rotation that complements the longitudinal experience of continuity clinic. It's an opportunity to really get immersed in a primary care setting for a month at a time or so. And this is a chance for residents to really immerse themselves in a large urban practice and do primary care 5 days a week. They have a chance to see well children as well as sick children. What I like best about it is a chance to really follow the natural history of an acute illness. So while residents might see a sick child in their continuity clinic afternoon, they don't really have a chance to follow them up through the course of that illness. And our residents take phone calls, so they may talk to a mother, one night to hear about their sick child, see the child the next day in the office, and have a chance to follow up to see that, see it resolve. Because the primary care center in Oakland serves a predominantly underserved population, it's a chance to really learn how to advocate for families and really help mitigate the effects of poverty. So like many of the primary care providers in our area, the general academic pediatrics faculty round at Magee Women's Hospital and the newborn nursery. And this is a great experience for our interns. They have a chance to really learn how to take care of term newborns. They do assessment, management, and a lot of discharge planning. And a big part of the rotation is learning how to counsel parents how to take care of their new babies, how to keep them healthy, free of infection and illness, and a lot of breastfeeding support as well. So primary care education and continuity clinic consists of the clinical experience and the structured curriculum that we have. So residents learn by seeing patients and precepting them directly with their either faculty preceptor or community preceptor. In addition, we have 2 core primary care topics that are covered every month. These are available online. They're prepared by the GAP faculty. They're case-based and evidence-based, so they can be observed at any time. And the GAP practices, we review them as a group. And the community practices, they're reviewed individually. In our continuity clinic, every week the residents are checking in with each other. If anyone's got a full schedule or they need to get back to the hospital, they'll chip in and help them see their patients, make sure everybody has a ride home, see who wants to stop for dinner. And the faculty take really good care of the residents as well.